I'm David Hardy. I'm a vascular surgeon. I'm originally from Georgia and moved to Ohio for about 3 years, and now I am just starting at South Georgia Medical Center here in January. When I tell my friends and family or just someone in the grocery store I'm a vascular surgeon, they say, "Oh, you do veins, right?" And then they proceed to show me their vein on their calf, and that's true. We do work on veins, but we work on every blood vessel in the body. I guess the simple way is to say I work on every blood vessel, artery and vein in the body except the heart and the brain, basically. Coming to the hospital, it was actually really nice. So I'm coming down from Ohio, which the weather there is not the best if you grew up in Georgia like I did. You get used to wherever you're at. But coming here to the hospital is really great. The people are phenomenal. Like, that's kind of, if you can find a place where you can work and the people are great to work with, I mean, you've won the battle, or you've at least won half the battle. When I was 16, I became a janitor at a doctor's office. Honestly, I had no real direction, if that's the way to say it, other than I did okay in school. I was a good kid, and the doctor at that doctor's office, he's a family medicine physician, called me in and said, "You know what, you need to do something with your life, and you'd be a great physician just the way you act and treat people." In my senior year in high school, I took a health occupations class, loved nursing, and that was it for me. So I started college in a nursing path, took a couple of anatomy physiology classes, and loved school so much that I said I want to do something where I'm in school or learning the rest of my life, kind of thing. And that really is what kind of clicked me back to that first moment in a doctor's office when I was a janitor, and said, "This is what I'm going to do. I can do it. I proved to myself I can do it," and yeah, and here I am. One time we were doing a case on a lady who could not walk. Like, she couldn't get her mail, she couldn't get out of the house, and it was because she had no blood flow to her legs. And we went in and put some wires and stents and just some stuff. It was almost like magic at that time. And she, like, an hour later, she felt the difference in her legs. And then seeing her come back in clinic, I had the fortune, she said, "You know what, I can get out to the store, I can go to Walmart, I can get to the post office." And I thought, that's it, that's what I want to do, because it was such an extreme turnaround on how she did. My philosophy is that I'm going to do the best I can. That's the philosophy I tell my kids with anything they do, and if you can do the best you can do and look yourself in the mirror, that's all you can do. There's nothing anyone else can ask of you. So when I'm with you, you're my patient. There's nothing else that matters. And sometimes that causes you to run a little late because you really just want to be with that patient and take care of all their problems. But yeah, when I'm with you, you're all that matters. I treat you like family. I treat you like I'd want my mom, my wife, my dad, my kids to be treated. And I mean, I think that's just life. And that's the golden rule.